What is attention deficit hyperactivity disorder, ADHD? ADHD is a mental health neurodevelopmental disorder commonly diagnosed in children and adults, which can have long-term effects on executive functioning, social and interpersonal skills, learning, and behavior. ADHD is usually diagnosed in childhood and can persist into adulthood. Symptoms of ADHD can include inattention, such as difficulty sustaining attention, forgetfulness, losing things, disorganization, and easily distracted. Hyperactivity, such as constant fidgeting, restlessness, difficulty sitting still, and talking excessively. Impulsivity, such as acting without thinking, interrupting others, blurting out answers, and difficulty waiting their turn. Emotional dysregulation, such as difficulty managing frustration, anger, anxiety, depression, and disappointment. ADHD can significantly impact daily life, including academic and occupational performance, social interactions, and overall well-being. Many people can manage their ADHD with the help of behavior modification, medication, and lifestyle changes. However, no single treatment works for everyone, as individuals with ADHD can have unique symptoms and struggles. As mentioned, ADHD is characterized by symptoms such as hyperactivity, impulsivity, and inattention. Anxiety is characterized by feelings of worry, nervousness, and fear. While ADHD and anxiety are two distinct disorders, they often co-occur. Here are several ways ADHD can cause or contribute to anxiety. Difficulty with executive function. People with ADHD often struggle with executive function, which is a set of mental skills that help plan, prioritize, and complete tasks. This can cause a lot of stress and anxiety when trying to meet deadlines, manage time, or complete projects. Moreover, the anxiety brake, the ability to stop fear messages from triggering the brain's fear center, the amygdala, and other areas, is an executive function. Difficulty with executive function can make it more difficult to control anxiety. Hyperfocus. People with ADHD often hyperfocus, a state of intense concentration on a task or activity of interest. While beneficial in some situations, hyperfocus can also cause anxiety when the hyperfocus is on something dangerous, negative, or unproductive. Impulsivity. Impulsivity is a common symptom of ADHD. It can lead to impulsive decisions or actions that can cause anxiety. For instance, impulsively quitting a job, making a large purchase that can lead to financial stress and worry, and committing to too many tasks and then worrying about not getting them done or feeling overwhelmed. Perfectionism. People with ADHD often struggle with perfectionism, leading to anxiety when they can't meet their high standards or when they make mistakes. Overly sensitive to criticism. People with ADHD are often overly sensitive to criticism and rejection, which can create a lot of anxiety when doing tasks and undertaking responsibility. Social challenges. Social challenges are common for people with ADHD, which can lead to social anxiety. For example, difficulties with social cues, interrupting others, or being overly talkative can lead to social rejection or awkward situations, causing anxiety. Poor self-esteem. People with ADHD often struggle with poor self-esteem and self-worth due to the challenges they face in daily life. This can lead to feelings of inadequacy and a sense of being different, which can trigger anxiety. Overthinking. People with ADHD often have racing thoughts, making it difficult to quiet the mind and relax. This constant mental chatter can lead to overthinking and worry, which can fuel anxiety. Rejection sensitive dysphoria, or RSD. RSD is a condition often experienced by people with ADHD, which causes extreme emotional sensitivity and a heightened fear of rejection. This can lead to anxiety in social situations or when faced with criticism or perceived failure. Overall, ADHD can cause anxiety in several ways. The above are just a few examples. It's important to seek professional help if you are having symptoms of either disorder, as treatment can help alleviate symptoms and improve quality of life. Attention deficit hyperactivity disorder occurs in approximately 11% of the population, 8.4% of children, and 2.5% of adults. From that number, approximately 64% of people with ADHD have at least one coexisting condition. For instance, 52% of people with ADHD have a behavior or conduct problem, 33% have problems with anxiety, 17% have problems with depression, and 14% have autism spectrum disorder. For this presentation, we're going to focus on ADHD and anxiety.